Hi, I'm Alice, the Director of Human Services and Advocacy at L'Arche. What's unique about L'Arche to me is that we are consistently asking people to question how they define care. As a provider who receives partial funding from Medicaid, care is very strictly bounded by time, location, and need. The expectation for L'Arche, from a government perspective, is often that we provide care only within our homes, to people only with certain needs, and only at specific times. My favorite thing about working for L'Arche is being part of stretching the idea and capacity to care. Because of you, and because of our donors, L'Arche provides care in hospitals when core people are admitted, even though we are not expected or compensated to do this. This has been critical to ensuring competent care continues to be provided to our core people, and that they are supported relationally and emotionally during their stay. If I, as someone without an intellectual disability, went to the hospital, I would have about an 8% chance of experiencing an adverse event. Adverse events could be anything from being given a medication you're allergic to being provided a food that you can't safely eat. Things that can really impact your care going forward. In contrast, people with disabilities have a 30% chance of experiencing an adverse event in the hospital. And those statistics don't even account for the continued bias and fear around treating and communicating with people with disabilities that we still encounter every day at L'Arche. Some studies indicate that 50% of physicians would prefer not to provide care to people with intellectual disabilities altogether if given the choice. L'Arche is committed to ensuring quality care for our core people in hospitals and rehab facilities to ensure we can advocate with them for quality care and facilitate connection and relationship between the core person and his or her care team. L'Arche also models that care is not bounded by level of need. Typically, Medicaid providers are incentivized or even encouraged to transfer a person to a different or higher level of care as their needs change. Some group homes have age limits or care specifications that, once crossed, indicate a person has to move and recreate entirely new relationships with different providers and caregivers. About 23% of people with disabilities have to move 3 or more times in their lifetime, with some having to move up to 11 times. Can you imagine being uprooted from your home 11 times, or just because you turned a certain age? At L'Arche, we do our best to change our models to meet the needs of each core person. Sometimes this means using donor funds for extra staffing, or redesigning our homes to better meet needs. When supporting our founding core person, Michael, with dying in his home as he wished, Luke and I were met with surprise by hospital staff and others when we shared that we would do anything to get him home. A common refrain was, "That's not what group homes usually do." We were proud to answer that we were not just any group home, but a community of people committed to each other. So much so that we were able to find volunteer nurses in our community to support us in preparing the home for Michael's return and ensuring his medications were properly administered. Our donors also enabled us to hire additional nursing staff for his final week with us, in which many former L'Arche caregivers traveled from all over the country to sit with Michael and hold his hand as he said farewell. This is what care means to L'Arche. Thank you for being part of this community and for working with us to continue pushing the boundaries of care. Together, we're able to honor the dignity and care of the whole person as their needs change for as long as we can.